We're now live and we're recording.
Excellent. Okay. Welcome to everyone who's joining. I can see that the numbers are coming up as everyone's entering the room. Okay, just a welcome to those who are joining us. We're just going to give it just literally like a few seconds longer because we've got some people who are joining literally as we speak. Okay, so I think I will make a start. I can see that some people are still joining us, but just for those of you who are with us and who are just literally coming in as I'm speaking, just to let you know, we are going to record this webinar, so and we will be able to circulate that afterwards if anybody would like a recording. So my name is Anya. I am the Chair of Trustees for ASSERT, and I'm also autistic. And I'm very pleased to say that this evening we have Jane Green, who is going to talk to us about Ehlers-Danlos syndrome, the hyperconnective tissue conditions, and how these kind of can relate to neurodivergence as well. So just to give you an idea of structure before I hand over to Jane, we are going to have the presentation is going to be until about just before 8 o'clock. Then we'll take a 5-minute break so that people can just have like a rest for their eyes from the screen and can get a refreshment if they'd like to, just a comfort break. And then we'll return after that until 8:30 so that you can pose your questions to Jane. If you have any questions that come up about Jane's talk, please feel free to post those in the Q&A section. You can find that at the bottom of the Teams. You can tell I've been doing a lot of these video things at the bottom of the Zoom window under Q&A, and just type in the question that you like to pose. I will do my absolute best to get through as many questions as I can, but just to let you know, I can't promise because of time constraints that I'll be able to pose every single one for Jane. So without further ado, I would like to hand over to you, Jane.
Thank you so much. I've got a feeling everything will go wrong with Zoom today because everything's gone wrong all day. So you might be on call, Jack, on this part. So I will.
No problem.
Screen. I've got disabled participant screen sharing.
Try now. Sorry, try now. There we go.
Just do. Okay, can you see the main screen?
Yeah, it's great.
Yep, can see it fine.
Oh, great. Right. So today is issues with our tissues, and my name's Jane Green. I'm going to talk a little bit about me because otherwise it's a bit impersonal just launching in. So first of all, you've got to know that I'm not a medical practitioner, even though I've learned lots of new words in the last few years, and I often mispronounce them, but I'm getting better. I am an educationalist. I was a professional educationalist, and I've got all my qualifications there because I'm quite proud of them. And I'll tell you why. So I left school early with minimal qualifications. I moved around a lot, but I was often absent from school due to physical issues and because I didn't enjoy it very much either. And I was considered dim. And after school, when I was able to leave quite as soon as you could, really, 16. Well, actually, you could leave earlier, but I didn't. I left at 16. I sort of became a nomad, traveling around for a while, couldn't settle in a job. During school, I always had issues like bloating, pain, but I didn't know what pain was. I thought everybody had knee pain, cold issues, migraine, a lot of that. So, and various illnesses and infections, but nothing that really, I just thought everybody had it. So I did have some dislocations, particularly this shoulder is bane of my life, one of them. And then after I moved around, I settled down and got married and had children. My first one, and even during pregnancy, was a big hit on my health. And I started getting really dizzy. I was always tested for diabetes and things like that. My eldest was born traumatic birth and had a lot of medical issues, and at age 3.5 diagnosed autistic, which in those days was really early. And I didn't know anything about it. All I knew about autism was the Rain Man. And I thought, no, this isn't right. And also some of the approaches and strategies I was given, I was very uncomfortable with. I didn't know why. I had no training. I had no education. But I was just, that was my gut instinct. It wasn't right for us. So I say to Carol Gray, actually, I started Social Stories. It's just that I didn't realize she'd done it before me. and all these sort of things. And I find that's often the way with ideas. People have done them before, but you might have come up with them as well at the same time. And so I started to decide that I needed to know about psychology to help my child. So I walked into a little open university office near me, and I asked to do a psychology degree. And, I hadn't put pen to paper because I didn't have a computer for years. And it was just like sick notes. And the reason is we kept being excluded, even from preschool. We were excluded and asked to leave. And my second child was also ill with medical issues, allergies and skin issues. And it was very full time. By that time I was on my own, and I started my degree. And after a while I realized that maybe I'm not so dim. So I did that. I won awards. I went on to do my teaching degree because I wanted to be an educational psychologist, because everybody I'd met had blamed me for bad parenting or not doing things right. And it was very challenging, and I was also told my eldest would never ride a bike, would never do this and never do that. And, you'll find this a lot. That's like a red flag. Well, I'm going to show you. And so that's what I did. And then, so to be an ed psych, you had to do a teaching degree. So I did that. And then I worked in an autism epilepsy school near me. And unfortunately, the ed psych changed that year to the doctorate taught level. But I still got a place, but I was so ill. I had operations during this time. I was so ill, I knew I couldn't possibly take it up. And that was a really pivotal moment for me, because it was really quite sad in a way, because I decided I wanted to do that. But then I just carried on doing my other degrees, and I became an advisory teacher for West Sussex in social communication, stroke autism. Then I was on the steering board for the Autism Education Trust, which is a social model of autism education. Then I became the lead for autism AET education with NAS, National Autistic Society. And I traveled all around. My eldest by then was in weekly boarding school, if you like, a special school. And I did all the paperwork all the time. I did the statement of SEN in those days before I even knew what it was, really, but it wasn't that difficult. Once you apply yourself, I could do it. It was just, I didn't know how to apply. I didn't know how to put words down, but it grew. And then I did my other degrees, and I didn't manage to keep my jobs for too long in each one. And then I became assistant head teacher and did all the autism medication training models in London. Unfortunately, because my health was disbelieved because it happens without trauma, so I can dislocate or injure myself and people didn't believe me, including medical practitioners. I am very literal sometimes, and if they say you can't have done that, I will believe them, even though I saw the evidence and felt the pain and had been to the emergency hospital. I actually say, well, they're saying it can't happen, so they must know. And so I carried on, and that inflammation grew and grew. So in 2015, I retired and I received my Ehlers-Danlos. And finally, after all these years, I wasn't just bendy. And I thought, great, I'll get some support and belief. And I did get belief, but I got no support because you're discharged. And that was it. And I was very, very ill. And that carried on for a couple of years, actually, to the point where I couldn't eat at all. And I just kept getting lots of allergies, which I'll talk about later. And there was no one really knew what was happening, including my children, who actually asked me, what is going on? Are you dying? And I didn't know what to say. And no one did. And it was a really uncomfortable place to be in, anxiety wise, of course. And I thought, this is wrong. And I bought my doctor a book on Ehlers-Danlos, and I had no money coming in. Because I wanted to do more. And then a year later, I haven't explained this very well. I always knew I was different, but I didn't know why. And when I saw Blade Runner, do you remember? You're too young. Blade Runner was in the 1970s, and I always felt sort of empathy for the replicant trying to be normal in the human race. And that's how I felt I was in all those years. So I got my autism diagnosis, although they did say I didn't appear anxious, and I realized I wasn't DIM, and that's why I advocate now on education and health in particular, social care and transport accessibility. So that's about me, and now we're going to get to Ehlers-Danlos. But I just want to say that it is quite powerful what sometimes I found doing these webinars, and people suddenly realize that they've got these issues as well, and it's quite overpowering for them. So I'm happy to talk afterwards, or if they want to email me, because sometimes it can be a bit much. Okay, so why do you need to know about it? Ehlers-Danlos syndromes have been around a very long time. So Hippocrates first mentioned it in 400 BC, and he spoke about the nomads and warriors. Nomads, again, that's funny. Had very lax joints and multiple scars, and they were pretty useless at drawing bows and arrows, because I'm not even going to do it with that one, but you're drawing the shoulder back and the elbow, and they were pretty useless, really. And then the painting over there is the Three Graces, which apparently illustrates hypermobility syndrome. And then this is a lovely name, Chernogobov, described AIDS in 1892 and said this disorder was a defect in the connective tissue. So I'm going to come back to connective tissue. And then Paganini. So you'll get a lot of musicians and gymnasts often seem hypermobile, and apparently he had such a wide handspan, he could play 3 octaves on his violin and was very fast, was very, very tall, very thin, and maybe had an associated condition to Ehlers-Danlos called Marfan syndrome. And then in 1901 and 1908, Mr. Ehlers was a dermatologist. So if you can't pronounce Ehlers-Danlos, that might be Ehlers-Danlos. It took me a while, actually. He was a dermatologist, and he first mentioned it, and then Dr. Danlos in 1908. And that's where the name comes from, which is always quite a mouthful. And then here we are. So we have Ehlers-Danlos syndromes. They are heritable. So that means they can be passed down, but it's not always absolutely consistent that it will be. You can look at the more statistics on that further. HEADS, hypermobility Ehlers-Danlos syndrome, which is what I have, and most of my members have, and the people I know have, most of them have HEADS, is the most common type. And the closely related hypermobility spectrum disorders. And they really are quite closely related. So that's why we put EDS and HEADS, or EDSers. It's considered rare by NICE, so that's 1 in 5,000. It's not rare as far as I can see because we have so many people with it, and it might be rare due to lack of diagnosis or misdiagnosis sometimes, definitely with me. I was diagnosed with fibromyalgia, first of all, and then chronic fatigue syndrome. I was put, in fact, I just had a tweet today. I was put on the path for multiple sclerosis because I was showing all the symptoms, because you get muscle rigidity and things. And apparently if you have a brain scan, this is off the top of my head now, but we do have lesions in our brain as well. I have had a brain scan, but I haven't seen it yet. So I'm going to wait for that. I'm going to chase that up. It's just reminded me. So all EDS, apart from the most common types, can be genetically tested, and that will be great, but we have no test. So we're a bit stuck, and it's a multi-systemic connective tissues disorder. So I'm going to talk about that a bit more in a minute. So how do they diagnose HEADS? Well, at the moment, it's using the Baton scale. Now, at this point, if I'm doing a webinar and I see people, they're usually trying to do these movements. It's fine to do it yourself, but I wouldn't start testing everybody on it because we shouldn't be doing party tricks too much, although I used to do them a lot. And but this is changing all the time. There's more research coming out, so this is what I've got at the moment. And then they do it on clinical assessment when you're in there. So skin is quite different. It can be really velvety and thick and smooth, or it can be really, really thin and frail. So they'll look at your skin, how it moves, how elastic and lax it is in certain places. They will also look at your history, so that's really important. So it's quite involved. There is a EDS RCGP toolkit, so that was designed 2019, and has a lot of the diagnostic criteria on there. And you could look at that. I would suggest you print it out now because it might not be hosted for much longer, but hopefully it will be. And then soon there's going to be a school toolkit for Ehlers-Danlos and hypermobility spectrum disorder. It says April, and that's quite soon. Oops. And I tell you why I'm worried, but I'm not worried. It'll be fine. So yeah, so there are about 13 different types of EDS and 4 different types of hypermobility spectrum disorder. But for management, they're so closely related, we often put them together. There are much rarer types, and these are really rare, as you can see. So we have VEDS, which stands for vascular Ehlers-Danlos syndrome, and this causes a weakness in the vessel walls and hollow organs, and you can get aneurysms as well. So this can cause ruptures, and you know, it can be life limiting, so as can HEADS actually, but this is more so. And so you do have a care diagnostic pathway for this, and you will be managed by your consultant for this, so that's extremely good and needed, absolutely. And then we have classical EDS or SEDS, which is also a defective protein in the collagen, and this has very thin elastic skin, and when the wounds don't heal so well quite often, and you get scars and really wide wide scars all over the body quite often. A lot of us do get, if you like, stretch marks for no prior reason, like we haven't suddenly got pregnant or put on weight. It just seems to happen. But for some people it's much more. But I want to just note that some people don't have problems with wounds at all or bruises. So I find with all these things, you're either hyper or hypo, and there doesn't seem to be a middle ground. So I've mentioned connective tissue, and you're going, I don't know what that is, or you might do, but it's found throughout the body, and it's in specialized areas like the joints, cartilage, muscles, the myofascial, which is a sort of sheet of fascia, adipose tissue, muscles, nerves, the nervous system, bones, blood vessels. Basically it's throughout the body, and it's also surrounds our cells and also found inside our cells. It's in the cardiovascular autonomic system, the gastrointestinal system, and mast cells, which I'll come to later. So there are a lot of words there, and I say them regularly now, but I'm aware that you might be wondering what I'm talking about. And the collagen gene that results in the body producing connective tissue is abnormal, and the actual fibers are weaker, and they lack strength, and they're just pretty bendy. So I am not immune to saying this. I say this a lot. I didn't originate this, but we never know who does. If you're going to build a house, and I'm not a builder, so any builders around here are going to cringe now, but you have a bucket of sand and a bucket of water and a bucket of cement, or whatever quantities you're meant to build a house with the cement and the bricks. If you use the wrong quantities in certain parts, you're going to get a really wonky house. And then say you're going to put people in, and you're going to put furniture in and your beds and so on, it's going to be weighted, and that's going to exacerbate the wonkiness. And then you've got to think about the waterworks and the electrics. How are they going to work in this wonky house? And that's when I say boom, basically. So some of the issues we have, and they're not all here. So if some of you have, but I've got this, I've got that. These are just some of them. These are musculoskeletal disorders. And because our connective tissue is much weaker and more lax and elastic, we're less likely to keep our joints within a stable range. So for instance, if I could go right far out, I'm not going to, with this arm, both arms, if that one wasn't damaged, far beyond the normal range. And I don't know what is the normal range. So I have to look, I have to remind myself that I'm only going to so far. But normally, if I'm not doing that, or definitely in prior years, I wouldn't know that. And that takes a lot of muscular effort from us, our bodies. Sometimes our joints don't form right, they're really, really shallow. And that also exacerbates dislocations, or what we call half dislocations, which are subluxations. They're more common actually than full dislocations. I've had a full dislocation. It's not nice. Well, none of them are nice, but a full dislocation, you actually don't breathe very well, whereas a subluxation, I can actually breathe through, but you go straight to hospital with a full dislocation. We're more likely to tear fibers in the muscles, so micro tears are really, really common. And it obviously, because we're trying to keep upright, it causes our muscles to work doubly hard. So sometimes we can get rigidity in the muscles, and they sort of go into spasm. So pain and discomfort is just a part of our everyday life and experience, and particularly sprains happen a lot. I know these are musculoskeletal, but we get so many sprains, and they take longer to mend than bones sometimes. They don't recover very well. Tendinitis, tendon ruptures, all these different things, tendinopathy. We don't sit properly. We find it harder to sit on our pelvis, our sitting bones sort of hanging when we're standing, or I don't know about you, but I've got this really straight chair today, but I often have one leg under the other and twisted around to make myself feel more stable. So, and you'll often find children in the W position, and I still do that if I don't check myself today. So we often find ourselves in weird positions. And I remember picking up the children once from school, and it was a hot day, and I was lying on the grass, and I was just leaning on the grass. I won't do it now, but I just had my hands back, and someone came up to me and said, "Can you stop doing that? You're making me feel sick." And I thought, what am I doing? I didn't know what I was doing, but apparently, well, my arms can go like facing backwards when you're facing forward. And she felt she had to tell me that. So I didn't know what to say. And then we get other things like burning, bursitis, which is trochanteric greater pain, and is a huge issue for a lot of us, and all those other ones as well. I'm going to move on. So, as I said, I had a diagnosis of chronic fatigue syndrome. A lot of the people I know have chronic fatigue syndrome or ME diagnoses. And this is a sort of tiredness that does not get better after a night's sleep. And it really varies in severity. I would say it's like a weight of heaviness. You can't even move your eyelids. It's like you getting a syringe and drawing out all the blood from you. Particularly, it happens around my head, arms and back, and then you syringe it with hot cement instead. I'm really sort of focused on cement today. I don't know why. So that's what it's like for me anyway. And you can't even open your eyelids, and you can sleep or need to rest for quite a few days, for me anyway. And everyone's different, and there are different types as well. So why is this happening? Well, it could be, I don't know, but these are just some ideas. It could be that we're working so hard to sort of stand up that our muscles are really working all the time. I know mine are, and that makes us really tired because they're working so hard. The ligaments are attached to the muscles, can't do the whole job either. It could be that we've got POTS, which I'll talk about later on, and that means you might have less oxygen going to the brain, which makes you extra tired. It might be that you're on huge drugs for pain, because we get in pain, and some of the drugs are can make you zombie-like, tired, dizzy. When you get a lot of injuries or illness or infections, you can also get different types of tiredness as well, and non-restorative sleep. So we know that a lot of people don't go into the good sleep phase. So they go to sleep at a normal time, they wake up at a normal time, but they've never gone into that good phase of sleeping. And then there are also other issues like spinal fluid leaks and thyroid issues as well, which can affect sleep as well. So, and the other thing are viral issues from infection, sorry, that can lead to extreme tiredness. So, why am I here with autism? So, you know, I wasn't diagnosed until I was 54. And all those years of saying that I think I am autistic were not believed, because I was a professional. Well, we didn't know about it before, but I was a professional. I was holding down a job. I had a family. I didn't love data, and I didn't look out of the norm, I suppose. And although if they'd seen me when I was younger, I was a new wave romantic punk rocker, and I did have multicolored hair then, so they might have believed me more then. Luckily those photos don't exist anymore, because I've got a couple, but we didn't have phones then, so that's good. And but all that time I wasn't believed at all because of those issues, and so I didn't have the supports and adjustments that I needed, and the belief, and just sort of, you know, I didn't feel I was in part of the autistic community at all, yet I was working in that area. yet I knew I wasn't neurotypical. And so I didn't feel part of that as well. And then when I did get my diagnosis, I was basically left with nothing. And again, I didn't feel I belonged because there wasn't anything for me to join. There is now. And again, so they were all younger or younger adult groups, or those with learning disabilities as well. So that was quite isolating, and I decided to set up another group. So I think the issue with women not being diagnosed autistic, and interestingly, when I was working, I actually mentored these young women and some men to be speakers and presenters, and it was really it was great, considering where they came from, having never done it before and couldn't speak at all, which I do sometimes when I'm stressed as well. And then going on TV in 2017. So I was really delighted with that. But I was not believed. That was the issue. I was not believed, but they were. And I think there's a gender bias. So there's a gender bias in the diagnostic testing. It is a male spectrum test bias, I think. And I think it's the same with medical health. I think most of the research has been originally done by men using white male mice, maybe. And we're very complex. These are medically unexplained symptoms, and they are complex. And what on earth is going on? So I understand it's complex. And the other thing is we cannot cure it. So maybe medical practitioners like a nice cure. But there are so many of us now around. There must be something more in it. So I strongly believe that any health strategy for autistic people must include Ehlers-Danlos syndromes and hypermobility spectrum disorder, and must include girls and women, or those taking hormones and self-diagnosed women, to look at this. I think it's really, really important. And I just want to say one thing more, actually. When I was training, all the training we designed was always about, obviously I was an autistic educationalist, so all my cases were boys mainly. I had a few girls and they were about 3, but mainly boys. And all the training was designed about dyspraxia, anxiety, ADHD, and obviously autism. And those were the 4 things. And I used to, because I was working in a multidisciplinary team, I would say to them, have you noticed, I didn't know hypermobility. I mean, I just was bendy. I said, have you noticed how sort of weak they are in muscle tone? That's all I ever said. And they always had issues holding the pen and the pressure and eating, often wore glasses, often had allergies, and sat in unusual ways. And it was very, there seemed to be a sort of theme coming out, but they weren't that curious. And I'm glad I had that gut instinct, actually. So I'm going to talk about allergies. This is really, really key for us. There are many different types. So I'm going to talk about the direct IgE mediated ones, and basically immunoglobulin E are sensitized antibodies produced by our immune system. So if you have an allergy, our immune system overreacts to an allergen, and it produces these antibodies called IgE or Ig or whatever, and they release certain chemicals, including histamine. And this can happen in the nose and the eyes and the lungs and the throat, or on the skin. And that's why, say you've got hay fever, you will be sneezing a lot and you'll be blowing your nose a lot. And sometimes your eyes are streaming. So it's not too severe, but it's unpleasant and it gets annoying. And then each type of these antibodies has a specific radar, so it targets which type of allergen it's going for. So some people are only allergic to maybe one type of dog fur or cat dander, unless you've got an anti-allergic cat. And then other people might be a whole load, and then it's more systemic sort of response from the organs to release more fluid. And that can also have an effect on your blood pressure as well. Really, really big time on that. It can affect the gastrointestinal tract and other things. So direct food allergies, you do need adrenaline pens. And my children are allergic to tree nuts, not all of them, but I brought them up, and it was quite scary at times because we didn't know what it was, hadn't ever met anyone with it before back in the hospital, but they could check with a blood test, and it was really, really difficult with my eldest child, but we did manage it. And the other thing is, because they came out allergic to quite a lot actually, but really allergic to nuts, we had to avoid any nuts on the may contain labels, which I find is really annoying because may contain is not very clear, concrete language for someone who suddenly became really literal and reading everything, and it made shopping really, really difficult. And I said, look, this is a jelly. It won't contain nuts, but it may. And we've just had to talk ourselves from an allergist. So yeah. And then the other thing is my other child, when he was 14, 15, he was such anyway, he's a lovely chap, but he was quite keen on experiencing life, and he'd come back and say, I don't think I'm allergic to this whatever nut it was. And I'd say, why is that? And I'd just look at him and know he'd been eating something and trying. But it was really close call with my second son. And I get really sort of stressed thinking about that because it was really close the second time. And you have to be really on top of your game there. So I'm going to talk about mast cells very briefly, because these are the allergy cells, and these are the ones that first respond to perceived or real attacks. Oh, I should have given you a warning. This is a skin warning, trigger warning, if you don't want to look away. So it can be both direct or indirect mediated, and the mast cell is a type of blood cell, so it really, as I said, plays an important part. And with the non-direct, sometimes these are triggered, so it's not a direct one food, it could be a range of foods for no particular reason. There's no test we can do, it doesn't come up in a test, doesn't come up in a skin prick, but we still have these reactions that you'd get possibly with direct food one. And oh my goodness, looks like I've got a tattoo on my arm. I haven't. So that's my SEDS group, and I really don't have a tattoo on my arm. That would be really weird. I didn't see that before. Okay. So where am I? Yeah, so the mast cells can react to different things. It can be exercise. Some people have issues with exercise, chemicals, fragrances, and stress. And I'm one of them. So I had training in this, and I didn't actually believe a word of it, but I was open to learn, and I did. But because I've had stress before and I was very inflamed with being ill, I actually got very, very ill with stress when I opened a letter one day and something else. And that can react to an anaphylactic reaction. So stress is definitely an indicator. But it was very important for me to know what was happening. And I think it is for a lot of autistic people to know what is happening to their body, even though you can't manage it. So even though I really wasn't keen on this training, it did help me. I realize now on reflection, so I take everything back I said about it, really. And I think it was quite very informative and useful. And it helps that when I know the blood pressure is shooting down or shooting up, because I can hear it now, and I know I can just feel it happening. I know what's going to happen. At least I know what to do. I know how to breathe or try to breathe through it. It doesn't make it go away, but it doesn't have such a big effect on me. And I think that must be, I mean, it still has an effect. As you can see, this is urticaria and angioedema here. It is incredibly itchy. Excuse me. Incredibly itchy. It's really, really hot on the skin, right on the surface of the skin. And if I'd had time, I would have got an egg and put it on there because it would have fried. It's that hot, but you're not hot inside. And then you can feel your breathing getting really, really shallow. And basically you feel really unwell. And also once you've stopped that, or even if you've gone to hospital, you can have a rebound effect. So you've got to be really careful afterwards, and it can have an effect on your gastro issues as well. So and the other thing I have with mast cell, so mast cell activation disorder is the diagnosis. You can get it diagnosed, but it's really, really hard because there's no test. It's quite new, but all the things you can be managed quite well with really good antihistamines and lots of other drugs and things, and taking a diary, and the other charities will talk about that as well. So things like rhinitis, sinusitis, hay fever, all these things are possible indicators. I would say if you've got eczema or your child has eczema as well, and hay fever, that might be an indicator. Okay, move on. Hormones, right? So people often say, does everybody get this? So if you've got EDS or HEDS in the family, it can be more heritable. Boys and girls equally can be symptomatic, can have this, both in children, but when it comes to puberty, it seems to change a little bit. And it really seems to kick off in puberty. And it might be due to progesterone. It could also be due to trauma, as I said, or viral symptoms. We know that girls with periods, heavy bleeding is common, and often they seem more clumsy the 5 days before a period, and greater tendency to dislocate, and they just seem to notice more pain in their joints and muscles as well. And also the contraceptive pill, if you're taking progesterone, that can also make things significantly worse for hypermobile people. Really does. So that's not so good. And then in pregnancy, we know, as I said with myself as well, you get in a hormone relaxin, and that really relaxes your joints, which it has to, because you're preparing for birth. And so there are a lot of issues with the sacroiliac joint, pelvic and pubis symphysis, or whatever it's called now, and gastrointestinal issues, more dizziness and fainting, and also varicose veins and stretch marks. Sounds great, doesn't it? And then menopause. That's the last one. There's very little research on that. Again, some people think HRT might help, and different hormones there, but again, there's very little curiosity there at the moment. So these are some of the issues. I'm just going to look at the time now. I'm fine. That's really good. I'm really on time. So you might not be able to see all this, but this is our leaflet. I want to talk about dysautonomia, and this is really important, but it's part of the sometimes people can have dysautonomia issues and not have Ehlers-Danlos. That's quite common too. So our autonomic nervous system with dysautonomia is not working properly. And basically we need our autonomic nervous system. It's that picture in the middle. It's not very technical. And we need it for doing things that we don't need to think about in our body, like breathing, consuming our food and making it usable, going to the toilet, heartbeats, things like that. The sympathetic nervous system helps with the blood pressure and the heart rate, and also for our flight or fight responses. So in August, early September, I get a lot of this because I find lots of black wiggly spiders coming out, and that is just my natural reaction. It's going to kill me, and I can't help that, but I know it won't. But I still get that reaction to flight, as long as I'm not I can move at that point. I can't always move, which is worse. And what you get is increased adrenaline. It shoots off the adrenaline to deal with this threat. And that changes your blood pressure, and it can increase your heart rate and so on. So it overloads, over responses to this, and can lead to fluctuations in heart rate. We often get this at nighttime as well. We get a lot of night palpitations with the heart, and that causes a lot of anxiety because you don't know what it is. So the sympathetic nervous system actually shoots off this with us, without a spider. It can happen without us really knowing why it's happening, because it's not working properly. And so it shoots off all these different chemicals, and that can lead to heart and blood pressure differences. So that's when I said I can hear this whoosh happening. And it can lead to actual sort of because you're getting all this adrenaline in, you're getting really, you're ready to fight or flight, so you're getting really, really anxious, and it's a sort of physical anxiety, not a mental one. And then we've got the vagus nerve, but I'm looking at the time, so which is part of the parasympathetic nervous system, and that has a lot of issues, particularly those with muscular cranial differences. I want to talk about POTS. A lot of basically women between the age of 15 and 50 predominantly affects them. And the main symptoms occur when you're lying to sitting quite quickly, or sitting to standing. And you will get symptoms of dizziness, weakness, lightheadedness, fainting, palpitations, migraine headaches, fatigue, nausea. Raynaud's phenomenon, really, really common with our hands, because the blood isn't really needed in the feet and hands, so we get Raynaud's. Vision problems and brain fog. Brain fog is really key and really annoying. And then bowel issues, kidney issues, and low plasma. So hormonal changes there can be a big thing, and there are charities that know much more than that than I do. I want to talk about the senses. It's getting really dark in here. Can you see me okay? The senses, I'm sure you all know about them. But for us with proprioception, because we don't have that feedback all the time, we really lack proprioception. And particularly after an injury, every single time my proprioception goes. So this is why we like to wear compression clothes, because it really helps me with my circulation, but it also helps me feel secure, and I know where my limbs are in space. The vestibular sense is also maintaining our balance. So it's a bit like, I'm sure you know, like when astronauts come back to Earth and they in that seat, they're actually carried out because they've lost their vestibular sense. So understanding our bodily feelings are really, really important, and particularly for children. And I want to talk about interoception because lots of pupils, and I'm going back to my education talk now, but lots of pupils or children don't actually have these bodily feelings. They don't understand like hunger or thirst until it's overwhelming. And for the parent or adult around, it seems to come out of the blue that like suddenly they're starving and they were fine, and particularly for us, it's pain. So we have pain all the time. It's like the motorway going along, it's sort of zooming around. But when we get acute pain, you might not notice it. And then suddenly everything hits us all at once. And this possibly is what's happening with our children. And this is interoception. So it's knowing if we're hungry, thirsty, if we need to go to the toilet, what our heart rate's doing. Also to do with external regulations such as temperature, itch, pain, or pleasure. So there is research out there. We have a patron called Dr. Eccles, who's not too far from us, and she's done research that hypermobility influences the autonomic nervous system, and that in turn affects the interoception senses. So, you know, all the links are joining up now, which is really good. And I think, you know, so much training on autism has been about autism, but we need to look at the physical health issues as well, because it might be a physical sensation, a physical explanation as well. And so many times I've done training, and let me just check the time. I'm getting nervous now. How long have I got? Put your hands up, please.
9 minutes.
Oh, okay. But I need to say this. So many times I've done training and it was all about anxiety, and they said, oh, and I could hear them talking before I went in, and they would say, oh, we're really worried about blah and blah and blah, and they won't eat and everything. Oh, they must be anxious. Well, actually, it might be that they can't eat because we get pain, we get gastrointestinal issues, we get spasms, we get reflux, and that's really, really painful, and it can make you anxious. I've been there. I know food can be really scary when you can't keep it down, and it's not because you're anorexic, it's actually because you can't keep it down. So pain, very quickly, we get all different types of pain: persistent neuropathic, myofascial, fibromyalgia type pain, complex regional pain. Over the years of going to hospital and seeing doctors, you get the pain chart, the tick box, and I've never known where to go. As I said, I'm always in pain. And I also want to say something that the doctor might like. I don't know why. So I don't want to say 1, I don't want to say 10. Do I say a 4 or do I say 7? It's complete guess. I have no idea what I'm doing. And I still haven't quite worked it out, because you're going in with one injury or one issue, but actually you've just done another one on the way. So which one do you talk about? And then I can't talk at all. So I'm mute. Some other symptoms very common are, as I said, headaches and migraine, tinnitus, sinusitis, temporal mandibular joint dysfunction, hyoid bait. This is hyoid bone displacement, dysphagia, and it can affect all your eating and swallowing. And very often with eyes, you get strabismus, which is basically crossed eyes, particularly at birth. Other issues we have are things like anesthesia, so local anesthetics and general anesthetics, particularly for me, but some people are local, so we're all different. And you need to follow a pathway for that. Epidurals might not work. And very often when taking blood, for a lot of members, their veins wiggle around and disappear. And they end up with these huge, awful bruises everywhere. Our teeth can be wonky. By the way, if you're going to have a, what do you call it, a root canal, and you're bendy, you're hypermobile, just think about it, because your roots can go like that too, and the dentist gets really cross with you, and you've also spent a lot of money and it doesn't work. I've been there, obviously, and dry eyes are also common. So I've said this slightly. Why is it happening? I think it's the gender bias, really, and just not believe, because it hasn't been seen, or it's just one of those things that women have. I often think, you know, when you sing historical stories and the woman faints, well, I keep thinking she's got POTS. It can't be the corset. She's just fainting all the time. So I need to talk about this. You can almost see it. This is the first UK school toolkit coming on Ehlers-Danlos and hypermobility spectrum disorders. And this is really important because we've got the EDS medical one, but so many parents have been desperate for their children to, their teaching staff to have some knowledge and understanding of these issues. And also sometimes they haven't been believed that their child has a strain or an injury or can't eat, and maybe the parent isn't trying hard enough, but they are, and they don't know why it's happening. So, and the teachers themselves and educational staff are really keen to have something they can take up. And really, it's a bit delayed because of COVID, and we've had trouble getting all the videos in and photos in when they're not at school and everything else. But it's been quite a hard year, and but this is launching really, really soon in April, and I'm delighted that Ehlers-Danlos Support UK and the Hypermobility Syndromes Association are funding this, and I'm leading the content for teachers. And we really hope that we know that more neurodevelopmental children have these issues. So I'm hoping this will cover some of that, so teachers can get key takeaway points and strategies and resources that they can use. And then finally, if you can't connect the issues, think connective tissues. Thank you.
Thanks so much, Jane. That was a really interesting and informative talk. I learned so much, and I'm really grateful to you for sharing your experiences with us, as well as your very, very profound knowledge. I'm in awe, honestly. So let me just do a time check. So it's now 19:57 or 7:57 for people like me who don't do so well with the 24-hour clock. So if we can reconvene at 8:02, once you've had a little break, and any questions that you have for Jane, please feel free to type them in the Q&A, and I will try to get through as many as possible. Okay, see you shortly.
Can't see.
Okay, welcome back everyone. Just a reminder that if you have any questions that you'd like to ask, you can pop these in the Q&A section. So we've got a few that have come through so far. Still time to post your question if you would like to. Okay, so I'll just get to the first question, which someone sent in beforehand. So Jade, is it okay to take some questions? Okay, so I shall start with our first question. So our first question is actually one person has sent two questions. Her first question: if you've been diagnosed with joint hypermobility syndrome, but feel that you meet the criteria for Ehlers-Danlos, should you get this officially diagnosed? And if so, what type of specialist would you see for this?
So joint hypermobility syndrome was she probably had a diagnosis a few years ago. And now, because of the new international consortium brought out the new classifications in 2017, it changed to Ehlers-Danlos syndromes and hypermobility spectrum disorder. I would ask why you think you need to, because, well, it's difficult to get one now anyway, but why do you need to if you're managed? If you're not being managed and you think you would get more support with an Ehlers-Danlos one, if that's what you think you have, then go for it. I have to say, so I was diagnosed with EDS3 in 2015, and since for 4 years up to 2019, I was diagnosed 4 different times in different ways, depending which rheumatologist I saw. So, you know, you might get one, but it might change again. I used to get quite anxious about it. You know, I don't like that. I like things staying the same quite a bit, but I don't worry about it now, because the thing is about it is, as I tried to say, it's still a developing area. A lot of research is still happening, and I think my cat's trying to get up. I think that what was I saying? Yeah, I don't think it matters unless you're not being supported or managed with what you have. And even if you have it, as I said, there's no care diagnostic pathway. So once you have a diagnosis, you're discharged unless they think there's a rarer type or particular area they need to work on. So you just go and see different consultants and practitioners. And, you know, one time I even had 7 different consultants in different hospitals, or 2 in the same hospital, different departments. Do they talk to each other? No. So and that's really key, because they have different hospital systems. So you do have to be an expert on your own body and your own experiences. But I think it is quite key that we are looked at, because if you're having, for example, steroid joints in one limb, or even one part of the limb, and then you want to put it in another, you've got to be careful when you have them. And if they're done by different consultants and different radiologists or whoever, it's important to know what drugs are being used. So I've completely forgotten the other part of the question. Sorry, you're mute.
I am muted. Good point. I am now unmuted, hopefully. And yeah, the second part of that question is, what kind of specialist would you see to look at getting that diagnosis?
So what you can do is you can see a general practitioner, your GP. I've just had a member who took in the EDS RCGP toolkit, and some information, extra information we had, and got a diagnosis that way, and she's over the moon with that. But usually the GP, it will do that if they feel confident. But if they're not, you are referred to a rheumatologist. I think usually, I might not be right, but I think it's always a rheumatologist, and or a specialist in that area. I should say that because someone else can do that too. And oh, sorry, my cat's here. Is that okay?
That's fine. It wouldn't be Zoom without a cat. That's the law.
He can't bear being alone. You've disturbed my thinking again. So yeah, you can do take the EDS RCGP toolkit, and I would also say note your symptoms down. If you go in and say, I think I've got EDS, well, that might not work. I mean, you've got to say what your symptoms are, how long you've had them, have you got anything in your family. It's quite difficult to get an EDS diagnosis because they want to see it in your family. So if you haven't got a sibling and your parents don't present with it, then it's quite tricky. Or maybe, you know, your parents have passed away. It's quite tricky to know, and they never got a diagnosis, which, you know, it's quite new. So it's quite difficult. And often people get hypermobility spectrum disorder, but again, that's an issue, and they come away feeling really sad about it. But I say it's you know, it's so closely related. Please don't worry about it. I've had it twice and gone back and forth. And the thing about the dislocations, it's not all about that. It's not about all the sprains and injuries. Some people get them, like me, but some people don't, and they have more internal bendiness inside, which affects them quite badly. So yeah, and then otherwise get referred. You can go privately, you can pay for it because there's huge waiting lists, so obviously. And so people go to specialists, there are quite a few of them, and I think it costs about £250 to £350 for an assessment. But again, there's still a waiting list, I'm afraid.
Okay, thank you. And then next question is, do you think fibromyalgia may be a result of being in an autistic burnout for too long? So kind of slightly tangential, but interesting question.
Really interesting. So as I said, most of us have a fibromyalgia diagnosis before getting EDS. The burnout bit is really interesting. I think on the lines of inflammation, yes, I think it's all part of it. I definitely was burnt out in two of those areas. I didn't want to know anything about autism after retiring, anything at all. And there were catalytic moments that helped me move on. But I think, yes, I think, well, fibromyalgia is a flare pain syndrome, so it comes and goes as well. So like inflammation can come and go, I think it comes and goes as well. And it's one of those pain things that I showed. So you get all different types of pain, and you get osteoarthritis because of maybe injuries to your bones or shallow joints as well. So you get that pain, and that can lead to that pain. So yeah, I think it's sort of all intertwined. And burnout is inflammation. You know, you've had enough, but I bet if they checked your blood, I think it's called the ESR, whatever, I can't remember, on your blood test will be really raised. So yes, I would say yes, but I'm not a clinician.
Thank you. And then we've had a couple of questions came through in the chat. So one person's asked about eating. So I don't know if you could just, I know you mentioned it in your presentation, but maybe talk about a bit about, I can't speak now, a bit more about the issues that associate with issues, and if you have hypermobility, what issues you might experience around eating food.
So it could be that you have, sorry, let me just move this across. It could be that you actually can't chew and swallow properly because of the issues with your joint and things. I'm not quite sure. Sorry, I'm having some trouble with my computer at the moment. I think I need to move this over. It could be, you know when you need a new computer, don't you? Okay, I'm just going to, as long as you can't see it, I'm going to ignore it. And it could be to do with that. It could be to do with reflux and burning, because we get a lot of that because of the lax reflux systems. It could be gastroparesis, which and motility issues in the stomach. And so either, you know, you eat food and it comes straight out all the time, or it's just sitting there and you get impaction on the bowels, and that's really, really painful. So all sorts of areas can affect. And then you've got the allergies as well. You know, if you've got that going on, there's quite a lot, I think, to consider why you might have trouble with food. And then you've got the interoception sense. You don't know if you're hungry or not. So all these things are really interesting, but unfortunately can have issues. And then you've got your teeth issues as well. So we often crack our teeth, and that, I know, I get abscesses occasionally, but I don't realize it with a pain issue. And I went to see the dentist, and you know that pain thing? I said, I've got pain in my tooth. And they said, well, how much pain are you in? And I said, well, I'm not sure, it's about that level. And they sort of prodded it, and they said, you've got sensitive gums. What you need to do is get some toothpaste and put it on. And I've forgotten the name. I think it was Sensodyne or something. So I bought some. In fact, I bought 2 tubes because it was getting quite painful. And I sort of put it on, and I was still waking up at night. And I remember going to some friends and taking the tube of toothpaste with me. And I was actually slathering white foam out. And they said, what are you doing? And I said, I've got toothache and I've been told to put this on, but it's not working, so I'm putting more on. And they said, they told me to go back, which is good because sometimes I need to be told to go. And I did, and I had an abscess, and the dentist said, I didn't think you were in much pain, so I didn't really look at it any further. Does that answer your question? Have I gone off on a tangent now? I didn't write it down.
Yeah, I think that covers, you know, because you've covered a lot of the issues around eating and, you know, the teeth, the gastrointestinal things, the digestive system. So yeah, I think that was a really, really clear answer. So Sarah has said that she has a 14-year-old daughter with chronic headaches and nausea. Her daughter is currently diagnosed with hypermobility syndrome and POTS. She's gluten-free, but she's sort of struggling for her daughter to get any improvement in her symptoms. Is it worth her seeing a neurologist because she's struggling and she's missing about 20% of school?
It's a big issue for schools. I don't know, is what I'm going to say, because I'm not a clinician. It's not, and I don't think clinicians can even do that. Headaches are awful, and nausea as well. I mean, there are specialists you can see. Obviously, she must be under a pediatric rheumatologist or specialist as well. And I would take their advice. There are many reasons for headaches. It's not clear cut. There are different types of migraines as well. But that seems a lot for her age. And I'm really sorry she's suffering, and from the gastro, but it could be, it's only probably all related, and the POTS as well, you know, that's really debilitating, I think, in the younger people, and they want to be the same as their friends. You know, it's really, really hard. I wish I could say more exactly what to say, but what I could do is find out for you more if you wanted, but I think that would be the advice I'd give.
Thank you. Oh, Sarah said yes, please, to you know, if you, because I think your information was on that final slide, wasn't it? So perhaps
yes, or link up with us if you're local, or there's a national charities as well, so I can signpost you.
Sure. Thank you. Okay, so let's see our next question. So someone has asked kind of a neurology type question. Do people with Ehlers-Danlos syndrome have autistic spectrum conditions because the brain has slight compression or therefore is differently wired?
I'm not sure about compression. I think possibly wired, you know, No, I mean, there's obviously a difference. There's so many of us out there. There must be something to do with the connective tissue, a difference there. So yes, wiring in a way, I suppose, the connective tissue. I mean, but why and why particularly women are more hypermobile? It could be due to the hormones, as I said, or other issues. I don't know, and it is quite bizarre, really. But at the same time, while we want to help people with hypermobility, we definitely don't want to cure people, autistic people. So, um, you know, but that doesn't mean one or the other at all. It just means we would manage our symptoms better.
Thank you. And our next question is, could you please share the link between fibromyalgia, stress, and hypermobility? So I know you've touched on this already. So yeah, if you could sort of talk about that, that would be amazing.
Stress. So there are different types of anxiety, and at least if you look it up, there are at least 6 different types, I think. And often I know from myself and having to see people, they would ask me if I'm anxious, and I might be. I do get anxious, but I don't exhibit it, except my cat's falling out the door and digging up the carpet and wants attention. And I think that I might have to go and let him out. The fibromyalgia, as I said, is a pain symptom. So we get a lot of these. We get all sorts of pain. We get myofascial pain. So if you're touching the skin anywhere, it can be agony. It feels like, for me, it was like someone punching me. And I went to see a specialist, and I was in so much pain for days and days, years on end, hour after hour through the night. And I went to see somebody, a specialist, and they would sort of do, I don't know if it was a technique called facial massage or something like that. And it felt, I was screaming, it was so painful. And I went back every 2 weeks. And then by the 3rd time, I said, oh, you're being so much kinder to me. It's so much lighter. Thank you. And they said, I'm using exactly the same pressure and techniques I did in the first one. So that's how sensitive I was to the pain. It was absolutely excruciating. And I don't often scream with pain because I can tolerate it, but it was that bad. So, and that's what I think. You go into flares, they're real, definitely real. But it comes in different, and it might be due to stress. And when you're under stress and in pain, your inflammation levels rise up. And that can create a spiral, like the mast cell cytokine storm. When you're in allergy, it can build up and build up and build up. And hypermobility, Ehlers-Danlos syndromes, for me, it's about inflammation. That's how I see it. I'm not a researcher, but that's how I see it. And for some reason, our connective tissue, because it is defective, it's lax, gets injured or does something else infected, and has a lot of inflammation, but I don't know exactly why, and I'd leave that to others to explain much better than I can, definitely.
Thank you. So our next question from Heather, what is the reason why so many of us have anxiety or depression issues? Is that to do with extra adrenaline, in particular with the anxiety?
It could be. There's definitely, I think, possibly 2 strands there for me. It could be to do with the anxiety of as I said, the POTS, the anxiety. I can see it in some of our members as well. It's sort of emanating from them. Even when they seem quite calm and happy, you can feel the anxiety. And they don't know what's happening. And you can get different types of POTS. And it's really, it causes anxiety if you don't know you're going to feel faint, or you can't go out the door. You don't know if you're going to make it back. You don't know why an injury's happened out of the blue without preceding trauma. All those cause anxiety because you're scared to do it the next step. And they say, well, it won't happen. We've seen people like this before. Well, we know it happens to us, but we don't know why. But the other thing I'd say is anxiety is not being believed. So a lot of people get post-traumatic stress disorder. And that can build up from, you know, when you're a young child, not being believed you're in pain and so on. For some parents, not being believed that their children have issues either, and they're thought hypochondriacs, or they're actually accused of things as well. And I mean, I have some PTSD, or have had occasionally in certain medical areas, but and I can see why it can happen, because you're back in that thing of not being believed. I mean, for example, I used to be an assistant head teacher. I had a job in London. I really liked my job, and I'd take a day off or more of holiday to go and see a specialist or whoever it was in a hospital. And so I'd actually take a day off because I'd had so many care days for my eldest and things. And I'd be there, and they would say, well, I see you think you've got a bad knee. And it was like the tone they were using. It's not like, I think, I know I had it put back in or whatever it was. And I said, yes, and also my ankle. Oh, you've got an ankle as well. And I go, yes, they're joined together, and the ankle did, oh, it's not possible. And I go, well, okay, you know. And then this person said, they looked at my age and they looked at me and they said, well, you're the same age as me, and we all get aches and pains at our age. And I went, that's when I went mute. I couldn't talk anymore. And they said, do you not like your job? So yeah, so, and that happened quite a few times, and I didn't know how to counteract it. I didn't know what to say because I didn't have a diagnosis then. And so what can you do? And so yeah, I definitely have PTSD there. And what happens is, when that happens to someone, you'll walk away, that fight flight, you'll either fight or you'll fly. Yeah, so I used to fly. And you don't go back to see your medical practitioner when you should be. So you might have other injuries and illnesses going on. And I didn't go back because I kind of knew, oh, this is the response I'm going to get. What is the point? So I didn't get that support. And I didn't have either diagnosis. I didn't know. I can talk, obviously, but I can't talk when I'm stressed, and I can't articulate what I'm feeling. Sometimes I can better by writing, but I think I couldn't do it then. And I didn't know what I was talking about, so it's a bit hard when you don't have that backup. I mean, what other disorder in the world has this sort of thing going on when you're completely not believed? At least, I mean, other conditions and diseases are awful, but at least you're believed you have it. When you're not believed, it's really traumatic. And I think that maybe is where anxiety comes. And then, of course, anxiety with autistic people, anxiety and depression can affect us as well. And we lose our jobs, we might lose our hobbies, our interests, everything like that goes. And so I think it would be abnormal not to be depressed when that happens, and you can't go out, and you're scared to go to meet friends in a pub or something, and you don't know how to explain what's happening to you, and they'll go, oh, are you ill again today, or something like that, and you go, oh, I'm out. I can't be that ill if I'm out. But yeah, it's really traumatic. So I think that causes issues as well, but I think it's more complex.
Thank you. So we've got one person who's asked, I know you mentioned about not always having restorative sleep. So they've asked, well, why is it that we don't go into more restorative sleep phase? Is there a known reason behind that?
I don't know. It's simple. I'm going to be honest. No.
Well, it's fine to, it's fine to not know. Some doctors won't admit they don't know. So
yeah. I mean,
it's always good to.
No, it's a good question, and I should find out. I will find out, because I don't like not knowing. and I don't actually know. So yeah, good.
So we've got an interesting question here, sort of a diagnosis related question. So we've got Jess has clicky knees, a thumb that that they can pop out of joint, but it doesn't hurt. They can play notes 2 octaves apart on the piano. As a pianist, I think that's a big deal. They have issues with their teeth, posture, gut problems, and so forth. Their question around this is it worth me getting a diagnosis, given that the symptoms are quite mild and probably none of them are treatable?
Oh no, they can be managed, and that's fine. You know, I managed when I was younger. I managed to travel quite far around the world with issues that were common. So I would say you might not need a diagnosis right now, but it would be good to learn about it, so you know. The same for children. They often don't get a diagnosis because it's hard to diagnose children with it unless they're really severe. But the management of it is really key to stop it, because if you have trauma when you're a child, if you have dislocations and so on, that is your future chronic illness there, right there on a plate when they get older. So what I would say, and I feel really strongly about this, is learn about it, educate others. We're going to educate the public domain, and so if you go out of range, I think you said clicky thumbs. So that can't be too useful if they're like coming out, if the thumbs are coming out. So you could get supports to do that. We could do some strengthening exercises for it. There's sensory stimulation to make sure the muscles and nerves know where they are. I don't know if I'm doing it right, actually. I'm not doing that. I've forgotten what else you said, dislocations of thumbs and something else. I don't remember, but that's what I'd say. There's lots of information. Again, we can signpost you.
And then just a couple of final questions. One is just, you mentioned the Royal College of GPs toolkit for EDS. Whereabouts can that be found online? Is it just a Google thing, or going to the Royal College of GPs site?
Just Google it. And it will be changing sites, the website. It's only for people aged 16 and over at the moment, although it does have children on there, so that will be slightly changing, and it will get to a new site, but I'm sure they'll give us lots of warning and notification where it's going. But you can print it out, so at least you've got that. And also the main charities and ours have information as well on what to look for, but most of them have that too.
And then our final question is about support groups. Is there a support group that exists in the local area?
I don't know where your local area is.
Oh, sorry, Brighton and Hove area, or Sussex area.
Yeah, because you said Australia before. Yes, us, Sussex Ehlers-Danlos syndromes and hypermobility. So do join us. We're across Sussex and the southeast quadrant of Surrey as well, and Brighton and Hove. This was founded 2.5 years ago by myself, because I just felt that it was going to be local in the local area I'm in, but it's just grown by demand, and that shows it. And we have helped save lives, and really proud of that. And the hardest thing is finding volunteers over time, because so many are ill, a lot of anxiety is there, and obviously, you know, if they've been ill, they haven't worked in these sort of levels and areas before. But we've got a great team at the moment, and we've got 2 patrons. We've got Dr. Eccles, who's a leading researcher in this area in Brighton and Sussex, and we've got Dr. Piers, who's the clinician in hormones, histamine, and MCAS specialist. I've actually had people coming to me now, so which is great. And we've got more people joining. We've just had she's a clinical psychologist just join us, Dr. Quinn Cirillo. I probably pronounced her name wrong. And so she's going to be helping us, and she has great interest in Ehlers-Danlos and autism as well. And if I've probably missed lots of people out, but yeah, so do join us. And then you've got the national charities, which I also help and coordinate, Ehlers-Danlos UK support. And so I do Sussex as well, and you can join both because they work differently, you know. And the school toolkit is with Ehlers-Danlos UK and Hypermobility Syndromes Association. I can't say that word, I don't know why, do apologize. So they're around as well. And then you've got the international one, which is the EDS Society. I think I've said them all. If I've missed one, I apologize again.
No, thank you. That's really useful. So apologies to those people whose questions I haven't been able to get to. We had many coming in. So yeah, so forgive me for if I haven't been able to read your particular one out. So just a huge thank you to you, Jane. I've certainly learned a lot, and I'm seeing lots of thank yous coming up in the chat for you as well. And you know, I really appreciate you sharing your experience and your time and, you know, your great expertise in the area. I'd also like to thank my colleagues at ASSERT for helping put the webinar together. Thank you to Jack Norwood from ADHD Aware for his excellent tech support in helping us get everything all to work smoothly. And thank you to everyone who's come to attend this talk. If you would like to help support more talks for ASSERT so we can put on more webinars and things like this, you can, if you would like, make a donation to us via PayPal. There are different ways to donate if you don't do PayPal. If you go to the ASSERT website, you can see different ways that you can make donations. So finally, thank you to everyone, and we'll keep you updated with things on our social media if we have any more events planned. Thank you very much.
Bye.
Bye.